afternoon, everyone. I'm really glad to be here this afternoon. So I do work for the West Island CIUS, but I try to make my presentation more general for anywhere you live and you access healthcare services and you're not satisfied, to try to demystify and explain what the complaint process is all about. So what are we referring to for care or services? So it could be dissatisfaction related to care from hospitals, CLSCs, CHSLD, even the ambulance service transport system, private senior residents, intermediate resources, family type resources, community organizations, so it's quite broad. What's particular about Quebec is healthcare services are grouped into territories. So I represent the West Island, but there's the same, there's 5 different territories in Montreal. So Centre-Ouest, which represents the Jewish, for example. So first, when you need to access care and services and you have an issue with that, you have to find the right complaint commissioner. But rest assured, if you do not find the right office, our office will gladly redirect you to the correct one. So what to consider if you're having an issue within the healthcare sector is, first, there's always people on site that could try to help you with the problems. You don't need to run to the complaint office right away. So ask to speak, for example, to the manager, to the coordinator, to the nurse in charge, and you can explain what the problem is and try to get a resolution right away. That's usually the best course of action for most of the problem when you don't wait too long. Obviously, if that step is not successful, you can always go to your local complaint and service quality commissioner office like ourselves. We're a group of people based, again, in each of these territories to receive people complaint and to try to get a resolution. When the situation is happening, wherever it's, with the home care services from the CLSC or from a hospital visit, it's always best to gather your information about the problems, what date it was, what are the people that were involved in the care, take their names down, write them down somewhere, even if you're not sure if you really want to complain, but you're thinking about it, because when it could be later on, after a few weeks, you say, this situation was really unacceptable. I need to make a formal complaint, but then you forgot which day it was, or you forgot which people were involved. So if you have those notes handy, that will be really useful for us to try to get a proper resolution of the problem. Also, if you have trouble formulating your complaint because it's so broad, there's so many facts, there's so many details, the local CAP, so it's the Centre d'Assistance et d'Accompagnement aux Plaintes. They're in each region, they're funded by the government, so it's completely free, and they're there to help you write up your complaint and get all the facts that you're telling them in whatever order, and they're going to make it a clear complaint. So if you look online or if you call us, we can give them their phone number, because sometimes it's a very specific situation. It's easy to formulate your complaint, but sometimes it's a series of different events, long duration. So you can always go to your local CAP, CAAP, in your area. So there's one for the whole island of Montreal, there's one in the Laurentian, there's one on the South Shore, and they're completely free to give you information about healthcare and complaint process to guide and support you during that time. So just to remind us, what are the different users' rights in the healthcare? So you have the right of information about your care, your health situation. You definitely have the right to ask about things related to your care. Right to choose your professional or facility, the right to consent or to refuse medical care, right to receive services in English, it's an important one. Right to access your user's file. If you need to look at your own medical file, you can always go through the medical record of the healthcare establishment, ask for a copy of your file. If it's medical writing and you're not used to, they can also provide a service to try to read the information to you as well. So that's one of your rights. The right to confidentiality about your user's file. And also the last one, the right to complain, and also to not have reprisal or consequences of making a complaint. That's really important. You should not be afraid to have consequences of getting bad care after you made one complaint. If we do get a complaint about that you got negative consequences of your previous complaint, that will be very serious and dealt with higher authorities. So I want you to not be afraid of making a complaint just for that fear of reprisal, or they're going to withdraw my services if I make a complaint. How does the complaint process work? So first, we do receive complaints, either verbal or written. Obviously, if there's many dates, events, facts, we may ask you to write it down just to make sure we don't miss anything, but you can certainly do it verbally if it's short enough. Afterwards, we will try to identify exactly what was the problem in the situation you're describing and try to solve it. We may ask you again for your version of events, how you perceived it, who was involved, what did you hear, what did you see, etc. We gather information as well for the other parties involved. So we may look in the medical file of the patients, ask any witness their version of events. We'll look at the different policies and procedure related to the care that you're complaining about. And we will certainly involve the manager of the service to know what they gather from this situation. So after that, we do render our conclusions. By law, it's 45 days. You are entitled to either a verbal response, so we can share a bit more information and exchange on that conclusion, or you can have a written report if you prefer. The goal of making a complaint is that if it's founded, if we do feel any part of it there was a problem or shortcomings, is to propose solution to resolve the situation, so improvement measures, or make recommendation to the management, to the organization, whether it's the hospital organization, when it's appropriate. And after all this process, there will be a second level recourse. So even if after all the work we've done at the complaint commissioner level, you're not satisfied with the conclusion or the measures in place, the protecteur du citoyen or the Quebec ombudsman can look over your complaint once again, and they're completely separate from the healthcare organization, and that's called a second recourse. But first, you have to place a complaint with the local complaint commissioner. So a bit more about the mandate of the Service Quality Complaint Commission. We're responsible of the application of each facility's user's complaint procedure with the new law that came into effect last December, so December 2024. There will be a unified complaint procedure for every healthcare organization in Quebec. That's still not yet in place, but this is the plan from the new law. We do have all the freedom and independence necessary to carry out our functions, so we report directly to the National Complaint Commissioner, which is at Santé Québec. So we're not directly, it's not the hospital administration that is our boss. We report directly to the national complaint commissioner, so it gives us the independence to look at any situation and issue improvement measures or recommendation when necessary. So we are there to listen and ensure that the user's rights are respected, and we make recommendation to the board of directors of the organization that's involved in the particular complaint. So I want to remind you that filing a complaint is a constructive approach, and it's a way to improve the care and services, because sometimes when you make a complaint, the care episode is finished, so it may not serve you directly, but it will certainly serve the next patient coming behind you. So this is why it's always important to speak up if you feel there was really something that went wrong, and we can take measures to correct it. So who can make a complaint? Obviously, patients themselves. If it's about your own care, definitely you can place yourself a complaint. But it can also be if you have a legal representative, they can accompany you. And now what's new with the new law is any person of interest can place a complaint. So if you accompanied your sister for healthcare services and she's too shy, she doesn't want to make a complaint, but you saw things that should not have been done, you can now make a complaint yourself on the behalf of your sister. These types of complaint may be dealt a bit differently, meaning we can't divulge medical information to you about your sister without her approval, but we can certainly assure you open an official file under your name and make sure you will have a reference number, and we will reassure you that this situation will be dealt as if your sister made her complaint. So what kind of complaint we can receive? Obviously, it has to be about the care and services that a patient should have received, is currently receiving, or that they require but have not yet received. So it's all of these things, again, related to healthcare services. It can also be the general services that is offered by the institution in general. So some of the different roles we do, complaint is in our name, so that's the most of what we do, but we also do some assistance. So sometimes you're not sure if some things are done correctly, you're lost in the healthcare services maze that sometimes it is. So sometimes people call us and we do assistance. So we try to help you, guide you, give you information about where to go depending on what you need. So it's not necessarily just complaint, but we will guide you to the right people to help you with whatever situation there is. We also do intervention. So we are officially by law the one registering any mistreatment of elders officially by the commissioner. So every signalement comes to our office, and we make sure that they're dealt with the appropriate authority. So that's also one of our roles. They're not per se complaints, they're signalements, so it goes into intervention. And we also get consultant about various different subjects, so that's our consultation role. So we do also medical complaints. Certainly when you want to complain about a medical doctor, a resident, a dentist, and so on, there's always their professional board that you can go to, but often they will refer you, have you tried to complain first at the local level? So complaining about the doctor, like I said, resident dentists or pharmacists are transferred to medical examiners that work within our office, and they're the ones that will be responsible of any complaints related to medical care. So they're examined by a medical examiner. They will also have the same deadline of 45 days by law. They do ask that the complaints usually is submitted in writing, and it's open to anyone. So it's really for patients and family that wants to complain about one or more doctors. So it's the same office, we receive the same, but it's specific medical examiner that that will examine thoroughly your complaints. So medical complaints is not anonymous, so the doctor involved will be notified that you make a complaint against them. But it is confidential, so it's not something that will be spread out to anybody else. It's really between the medical examiner and the different people involved, which includes the doctor involved, because he's gonna also be asked his version of events, his notes, his reasoning for having done or not done a specific care or service. So the most frequent complaint motive are really related to the care and service rendered. So, error medication, they didn't do the dressing properly, I wasn't changed, my diaper wasn't changed when I was in the emergency room, things like that. And unfortunately, the other big part of complaint is interpersonal relations. So some interaction that you have with caregivers sometimes are not the best, and that can lead to formal complaints. Thank you, everyone. That's kind of summarized. These are the coordinates for the West Island Complaint Commissioner. Again, if you're not from the area, you do have your own local complaint commissioner, but if you don't know how to find it, you can certainly call us and we will direct you to the right office. Thank you.